A patient tells you he's going to kill his ex-girlfriend the moment he leaves your office. Do you stay silent or do you break confidentiality? A nurse gives a patient the wrong dose overnight. Does anyone have to tell the patient what happened? If you're studying for the MCCQE, these concepts are everywhere. And it all comes down to two main concepts, confidentiality and disclosure. So let's break them down and then run through some MCCQE-style questions using the Toronto notes. Welcome back. This is part of the ongoing ethics review series for MCCQE. Last time we discussed consent and capacity. Today is confidentiality and disclosure. If these topics are useful, please hit the subscribe button and let's get into it. A 32-year-old man tells his psychiatrist in details that he plans to kill his ex-girlfriend as soon as he leaves the appointment. He names her and describes where she lives. What is the most appropriate next step? Maintain strict confidentiality, since this was disclosed in a therapeutic setting. B, take reasonable steps to warn the identified victim or notify police. C, document the threat in the chart and take no further action. D, wait to see if the patient calms down before deciding. E, only act if the patient has a prior history of violence. And the answer is B, a serious imminent threat against an identifiable person triggers a duty to protect that overrides confidentiality. You don't need a documented violence history. A specific, credible, imminent threat is enough. Silence or documentation alone isn't protective. A 6-year-old presents with bruising in patterns inconsistent with the explanation given by the parent. The physician suspects abuse. The parent explicitly refuses permission to discuss this with anyone else. What is the most appropriate action? A, respect the parent's refusal since they're the substitute decision maker. B, report the suspicion to Child Protective Services regardless of parent consent. C, discharge the child and document the concern for the family doctor. D, confront the parent directly before deciding whether to report. E, only report if the child confirms the abuse verbally. So the answer is B. Suspected child abuse or neglect is a statutory reporting duty in every Canadian province. It does not require parental consent, certainty, or the child's confirmation. Reasonable suspicion is the threshold, and the report goes to Child Protective Services directly. A patient is confirmed to have active pulmonary TB. The patient asks the physician not to tell anyone, citing fears of stigma at work. What is the most appropriate response? A, honor the patient's request, since TB status is confidential. B, report the case to public health as required and explain this obligation to the patient. C, report only if the patient develops symptoms severe enough to require hospitalization. D, delay reporting until the patient consents. E, report only the patient's workplace, not public health. So the answer is B. Active TB is a reportable, communicable disease. Reporting to public health is a legal obligation that does not depend on patient consent. But good practice is to explain to the patient why you're required to report, preserving trust even while fulfilling the duty. Question 4, fitness to drive. A 74-year-old man with newly diagnosed moderate dementia is assessed as unfit to drive. He insists he feels fine and plans to keep driving. His province has mandatory physician reporting for medical conditions affecting driving. What is the most appropriate next step? A, respect his autonomy, since he is still capable of daily activities. B, report his condition to the Provincial Transportation Licensing Authority. C, ask a family member to hide his car keys instead of reporting. D, only report if he is involved in a motor vehicle collision. E, refer to a lawyer before deciding whether to report. Answer is B. Where mandatory reporting legislation exists, the physician must report a condition that impairs driving safety to the relevant authority. This is one of the clearest statutory exceptions to confidentiality, and it does not require the patient's agreement or a collision to have already happened. Question 5. A nurse administers 10 times the intended dose of a medication overnight due to a decimal point error. The patient is monitored, treated, and recovers without lasting harm. The care team is unsure whether to mention the error since the outcome was ultimately fine. What is the most appropriate approach? A, disclose the error to the patient since disclosure of harm is required regardless of outcome or liability concerns. B, disclose only if the patient specifically asks whether anything went wrong. C, withhold disclosure since the patient suffered no lasting harm. D, disclose only to the hospital's risk management department, not the patient. E, wait until legal counsel confirms there is no liability before disclosing. Answer is A. Disclosure of harm errors is owed to the patient, independent of whether there's lasting harm or legal exposure. The duty to disclose and the question of liability are separate. You don't wait on one to fulfill the other. Patients are entitled to know what happened to them. Confidentiality, that's the default. Broken only by consent, circle of care, or a defined exception. Statutory reporting duties like child abuse and communicable disease, duty to protect against a serious imminent threat, and fitness to drive reporting where legislated. Disclosure is a separate, standalone duty. Patients are told about harmful errors regardless of outcome or liability. If this helped, drop a like, subscribe for the rest of the ethics series,